Hello?
Yes, yes.
Yes.
आवाज ही नहीं आ
Good
रही
evening, everyone.
आ रही है
मुझे नहीं आ रही है
अच्छा
एक मिनट मैं एक बार लीव करूं फिर
Wait for 2 minutes.
So you can reconnect, and I think Anchal, you want to start, or shall I?
मुझे एक मिनट मैं लीव करूं एक मिनट
हाँ.
हेलो रीता, हाउ आर यू? यू आर
श्वेता, पहले
म्यूटेड
आप
म्यूटेड
पहले
म्यूटेड
आप कर रहे हो या पहले
Okay,
डॉक्टर
so
सज्जाद?
Dr.
You are
Sajjad has
muted.
some network issue. Either you can quickly start, or if you want, then I'll start because Madam is actually traveling.
Okay.
Nina, Madam is traveling.
Yeah.
So
Right. So, good evening, everyone. It's my proud privilege to invite all of you for a very, very important webinar, which is related to holistic medicine. As we all know that it's not only medicines that work for any disease or any kind of management. It is basically the human overall, and we have to look at all the aspects, starting from the anatomic, physiologic, also the mental and other medicinal forms as well. So that is why we thought of integrating all the medicines in under one roof and talk about health as a whole. So to start the webinar, I invite Dr. Shweta Gupta, who's the Secretary General of IFS. So we will start with her address.
So thanks, Anchal. I think on behalf of Indian Fertility Society, I welcome you all. This is a very special and unique SIG. I think as a clinicians, we are all the time we are focused on the surgical procedures or on the injections, but we also, we forget that the patient is a human, and in we forget to look into the complete totality of the treatment, and that's why this special SIG was made, and it is mentored by our ma'am, Dr. Gauri Devi ma'am, who had been the past president of Indian Fertility Society and has a huge clinical experience of dealing with the patient. And we are lucky to have her here today. And the first talk will be given by her. We also have this group is managed by by Dr. Saeed, who is a very enthusiastic and dynamic convener, and also two dedicated co-conveners. Dr. Anjali has also joined, and Dr. Anchal. So I think we all are going to gain from this webinar, because most of our specialists, and we just focus on the injections or on the surgical. This is going to give us a broader view, a complete holistic, which will not only increase the patient satisfaction but also the output. So I think I'm not going to take Dr. Nina. Madam is actually traveling, so won't be able to join, but all her wishes are here for this webinar. So I'll hand over to Anchal for further, and Dr. Saeed also has now joined. So let's go ahead with the first talk.
Yeah, thank you, Dr. Shweta.
so respected hello
Please go ahead.
Go ahead, we can hear you.
hello
We can hear
respected President Professor Dr. Nina Malhotra, our esteemed Secretary General, Dr. Shweta Gupta, respected mentor Professor Gauri Devi ma'am, distinguished moderators Professor Dr. Sudha Prasad ma'am, eminent faculty members, respected panelists, colleagues, and dear delegates from across the country. Good evening and very warm welcome to you all. It is my privilege and honor as the convener of IFS SIG Holistic Medicine to welcome you to today's national webinar on effects of holistic medicine on infertility and reproductive medicine. Infertility is no longer viewed as merely a reproductive disorder. It is a complex condition influenced by genetics, hormones, nutrition, lifestyle, environmental factors, stress, sleep, metabolic health, and emotional well-being. As fertility specialists, we increasingly recognize that successful treatment extends beyond medications, surgery, or ART. It requires caring for the whole individual and the couple. Holistic medicine embraces this broader perspective. It combines evidence-based lifestyle interventions, balanced nutrition, mental health support, adequate sleep, physical activity, stress management, and selected complementary therapies such as yoga, meditation, acupuncture, and Ayurveda alongside modern reproductive medicine. The goal is not to replace scientific fertility treatment, but to complement it through a patient-centered approach that optimizes overall health and reproductive potential. The Indian Fertility Society has always been committed to advancing excellence in reproductive medicine. Through this special SIG, our vision is to promote awareness, encourage scientific dialogue, support research, and facilitate the responsible integration of evidence-based holistic practices into fertility care. Today's webinar brings together some of the most respected experts in reproductive medicine. We are privileged to hear their perspectives, review their available evidence, discuss real-world clinical experience, and explore how holistic approaches can be integrated into routine fertility practice while maintaining the highest scientific standards. I encourage all the participants to actively engage in the discussion, ask questions, and share your experiences. Meaningful progress occurs when evidence, experience, and collaboration come together. I sincerely thank our respected President, Professor Dr. Neena Malhotra ma'am, our Secretary General Dr. Shweta Gupta ma'am, all our distinguished speakers, moderators, panelists, the IFS Executive Committee, and the organizing team for their constant encouragement and support in making this webinar possible. I also extend my heartfelt gratitude to every delegate who has joined us this evening from all over the country. Your participation reflects our shared commitment to improving the lives of couples struggling with infertility. With these words, I warmly welcome you all once again and wish everyone an enriching, interactive, and thought-provoking scientific session. Thank you all, and I now invite our co-convener, Dr. Anjali Patil, to introduce today's webinar. Thank you.
थैंक यू सो मच डॉक्टर सैयद
वो
सर
डिवाइसेस ऑन है, आप एक ऑफ कर दो, बहुत एको कर रहा है.
कैन यू हियर मी डॉक्टर आंचल
Yes, we can.
So thank you Dr. Syed sir, and good evening everybody, and I'm really thankful for everybody who has joined today, and I would really give you a welcome to join this holistic medicine approach which integrates mind, body, lifestyle for fertility and well-being. You know, when we come to the point that why we are talking on this subject actually. So what we as a clinicians, we know that the lot of interventions and lot of innovations have been done in reproductive medicine, and then we just see the patient as a biology, that is the how the number of oocytes or how the patient's tubes are, or how her uterus is, and same we see in the male. But we have to know that the biology is supported with even the other factors, like they have to be very much fit, they have to be psychological normal, they have to have a good weight, they have to have a very good nutrition. So what I think is that in this webinar we are going to discuss that holistic medicine is not going to replace our reproductive technologies, but it will go hand in hand, because when we are going to add this holistic medicine, we are going to treat the human also. So I think so in this today's webinar we are going to discuss regarding the same, that we have very nice speakers, that is Gauri Devi madam, and then we are going to have a good panel discussion how to manage the case. And that's why what I think is that there are many other approaches, that is like lifestyle modification or nutrition, or then lot of screen time is there, or then they have wrong this thing, they have consume alcohol, they have this thing smoking issues and everything. So somewhere even the confidence is gone, and that's why what I think is that we have to tell them that fertility is not the issue for you, infertility, rather all these factors are making you more stressful. So what I think is when we even try to inculcate all this holistic medicine in our treatment protocols, so definitely we are going to have more chances that we can make that person or the couple stable, so they can even when they accept the positive approach, even they can accept the negative approaches, because even though we tell, it is the mind which plays. So by these methods we can help them out to accept even the negative approaches. So I think so in today's webinar we'll have a much more fruitful things discussed today. And so I again once more welcome you all for this beautiful webinar. Thank you. And after this, I think so Dr. Neena Malhotra madam was to talk few words.
She is not here. She is in Ireland.
Okay, yes, I know that, but anybody is going to convey in her absence?
Dr. Shweta has already come.
Okay, thank you. So then we can now move to the next session, that is we are going to have a talk on effect of holistic medicine on infertility and reproductive health, and Professor Gauri Devi is the speaker, and I think chairpersons are Dr. Sonia Malik, Dr. Suvin Gunman, and Dr. Shweta Mittal. Dr. Anchal, can you please go forward?
So I can, if there are CV, we have a CV for ma'am.
Oh, forget it.
Anyway, so
you can read the slide. That's enough.
Yeah. So what madam actually needs no introduction. She had been our past president of Indian Fertility Society. She is director of Gauri Hospitals and director of IVF, and also she is president-elect of Fertility Preservation Society. So she is going to speak today on holistic approach for the in reproductive medicine and IVF. So over to you, ma'am. I think there is a lot of echoing still.
नील मेरे स्लाइड मूव नहीं कर सकते हो?
It has moved now to the next slide, second slide.
So the first slide.
Mukul, are you there? Mukul?
Yes, ma'am. Yes, ma'am.
Yeah, can you please check why is there so much of echo here?
Everyone's voice is echoing. Anchal?
Yes.
Anchal, yours, Shweta's,
Shweta,
everybody's voice is echoing.
Yeah, so that's what I am asking him to check, ma'am, the IT.
Why there is so much of echo coming?
Everybody's voice.
So you unmute everyone.
Mukul, can you
Okay.
fix
Ma'am,
this? please?
Okay.
Ma'am,
It's my voice also echoing?
Yes, ma'am. Yes.
I'll check.
Yes.
Ma'am, Mukul is checking. Just give him 2 minutes.
Okay.
Fix that.
मैम सबके माइक ऑन है, एक बार
What we
सबके
should
माइक
do is
ऑफ.
mute everybody. मैम आप चेक करो बोलकर.
Can I start?
There's still some echo.
हम किसी के फोन से या कोई दूसरा डिवाइस उससे आ रही है.
मैम किसी ने अगर 2 डिवाइसेस पे लॉगिन किया है तो प्लीज एक लॉग आउट कर दीजिए. मैम अब आप चेक कर लीजिए. इज माय वॉइस इक्विंग?
Hello. Is it fine?
एको अभी भी है. मुकुल कोई भी 2 डिवाइसेस पे नहीं है.
Maybe unmute everyone and then only, mute everyone, only
Yes.
Dr. Gauri ma'am mute,
Yes.
unmute.
Yes. बाकी सबको म्यूट कर दो.
नहीं previous slide ना previous slide कभी कभी आता है कभी कभी नहीं आता ये कैसे है
यही है।
अच्छा नहीं ये थर्ड है अब आ गया नहीं ये थर्ड है हाँ दिस इज अच्छा फिर गया Is it okay now? My voice is not echoing?
No,
Okay.
ma'am.
Okay, that's great. So in this topic of role of holistic medicine in infertility, I'll just generally cover as to what are the ART limitation, what is the patient's demand, defining the integrative reproductive care, where holistic medicine fits in the biomedical model, biology of stress and reproductive axis, where HPO crosstalk and the hypothalamic pituitary axis. What is the evidence, therapy by therapy, about nutrition, mind and body, acupuncture, yoga, etc. Environmental and lifestyle exposure, which are modifiable, and critical appraisal, where evidence is strong, weak, or absent. And also, what is a practical integrate model where we can use these measures to support our reproductive medicine. Now, coming to the next. Raja Firat again. Okay. Now, if you look at the worldwide experience, 1 in 6 people of reproductive age worldwide experience infertility. And mind you, of them, 30 to 35% of the couple turn into complementary or integrative therapy along with ART. This is the world statistics. Now, of which, we have advanced quite a bit in reproductive medicine. We have done so many advancements and AI and this and that. But the end result is we have only 30 to 40% of live birth rate per IVF cycle in a fresh cycle. So what is it that we should be doing with these alternate medicine? A patient-centered model that layers evidence-informed lifestyle, mind, body, and traditional system interventions it's never will replace our ART. Only thing is, it can probably, as Dr. Anjali said, it can be a sort of a layering into the system. Now, mind and behavior is stress physiology, the CBT, mindfulness, mind-body programs. Nutrition and metabolism is very important. Dietary patterns, weight, micronutrients that is to be added to the to our routine medications, gut endocrine axis, and sleep is also very important. The circadian. We have found those who undersleep or those who do not get enough sleep, those who are on shift duties, their ovulation, there is a dysregulation. Traditional systems like acupuncture, yoga, Ayurveda, Chinese medicine, they are selectively evidence support. Like Chinese, it's all Chinese only. It's a one country report result. We have not tried it. Now, another important point is EDC, or the endocrine disrupting chemical exposure, which includes bisphenols malls, and I'll be coming to it as I talk. Now, what happens when there is stress? Why we are worried about stress? Because whenever there is, which in turn increases the ACTH and GNR pulsatility comes down. Increased ACTH means adrenal cortex secretes more of cortisol, and this in turn will suppress GnRH and LH pulsatility. So there is a ovulatory dysfunction is there. So that is a possible mechanism during the stress. Mind and body program for infertility. There was a landmark RCT which came in 2024, wherein mind body program and fertility support, a 10 weeks, 135-minute per week group program combining CBT, the psycho education and relaxation and hatha yoga. What did they find? They showed improved, this improved psychological part of these patients. It is basically the psychological. And the structured stress management components gave a significantly stronger reduction in anxiety. But in this, they did not find any difference in the medically assisted reproduction pregnancy outcome in both the groups. So we do not know. This definitely reduces the stress, but it has not really materialized into a live pregnancy, live birth outcome. Now, what does the broader literature show? Whether generalized stress causes infertility, it is inconclusive across cohort studies, but distress reaching clinical mental disorder level does appear to reduce the ART success. Psychosocial interventions improve the well-being in the infertility-related stress, and evidence for a direct increase in pregnancy and live birth rate, it is promising, but we do not have a definite evidence. Meta-analysis cite very low methodological rigor, or there is a bias, or the studies are so few. What about nutrition? It definitely improves reproductive health benefits. Important nutrients being folic acid, vitamin D, iron, zinc, selenium, antioxidants. Now, it will better egg quality, improved sperm quality, reduced oxidative stress, improved implantation, and healthier pregnancy outcome. Now, dietary pattern and fertility outcome. What is the evidence review? Let us see. In American Journal of Obs and Gynae in 2023, in a systematic review and meta-analysis, they found Mediterranean diet adherence associated with improved fertility outcome across the reproductive lifespan. This is a sort of a cohort data. ART specific. In a 2024-25 systematic review, 4 of the 8 ART studies showed statistically significant association between Mediterranean diet and higher clinical pregnancy. Now, diet rich in trans fat, refined carbohydrate, added sugar, they are associated with reduced female fertility markers. So the caveat in the 2023 meta-analysis concluded current evidence is insufficient to support clinical application despite favorable trends. More RCTs are needed. So anywhere we look at, we require more and more randomized controlled trials. Now, what about acupuncture and fertility? What is the potential benefit? It reduces the stress, improves the pelvic blood flow, probably betters the endometrial receptivity, and generally the IVF, probably, they have done something extra. Maybe it gives them a little confidence. So current evidence is it may improve well-being and treatment experience when it is used along with the conventional treatment. Now, in acupuncture, there is definitely a genuinely mixed evidence base. Updated 2024 meta-analysis, this is a Chinese study, mind you, they reported improved clinical pregnancy and live birth rate with electroacupuncture as an ART adjunct. Timing and dose matter. Courses exceeding 1 menstrual cycle show larger effect than single session protocol. You should keep repeating it. Earlier meta-analysis in 2021, they found no benefit. And Schwartz et al. Reported a possible negative effect also. So heterogeneity in protocols, sham control design, and public bias, they limit the firm conclusions. What about meditation and mindfulness? Meditation helps. Why? It reduces the anxiety. It improves for the patient to cope with the fact of, they are infertile, egg cycle fails, or you're not able to retrieve the eggs. So the coping skills are better. It enhances the emotional resilience of the patient, improves the treatment experience, improves the quality of life. And what is the evidence about yoga? Now, yoga in primary infertility, 105 patients, 3 months of yoga, asana and pranayama, before fresh embryo transfer, that improved the anxiety, depression, and fertility quality versus no yoga control. RCT in PCOS. PCOS number 61 cases were studied. 6 weeks of yoga reduced the hirsutism and abdominal hip circumferences versus routine care. Domar et al., original yoga-based mind and body model, reported a 55% one-year pregnancy rate vis-a-vis 20% in control. This was widely cited, but nobody could really, what can you say? They could reprint it or show it in their studies. So this is only a single study result. In 2023, meta-analysis of 14 RCTs, 1,784 women. This is a Chinese study. Mindfulness-based intervention reduced anxiety vis-a-vis conventional care. 2023 systematic review confirmed mindfulness improved mental health markers in infertile women, but again, evidence on pregnancy rate remains limited. In a 2024 RCT, extremely brief meditation during embryo transfer weight, this has no significant effect on pregnancy rate. They especially did it that before embryo transfer, if they meditate, will it help? But they found that is of no use. Let us go to Ayurveda and Chinese herbal medicine. Ayurveda 2023 scope review, a growing body of clinical studies on Ayurvedic protocols for PCO-related infertility with reproductive outcome. It was the most studied endpoint. Small studies reported 62 to 75% conception rate after multi-month herbal and Basti protocol in PCO subfertility. Promising, but they are all uncontrolled case series or single center or single bias studies. Best support exists for special botanicals like, ashwagandha, shatavari, on stress hormone and menstrual regularity markers. But this also doesn't materialize on an increase in live birth outcome. Coming to Chinese herbal medicine, meta-analysis of about 1,721 women as an adjunct to IVF associated with higher clinical pregnancy and live birth odds vis-a-vis IVF alone. Systematic review of anovulatory infertility, again it was 1,600 women, but all from China, reports a favorable ovulation and pregnancy rate. Grade quality is consistently low to moderate, single country trial base, inconsistent herb formulation, so high risk of bias. Now, what about exercise, body weight, and circadian health? Moderate to regular activity is associated with, improved ovulatory function and IVF outcome. But excessive high-intensity exercise may impair ovarian reserve markers and cycle regularity. A dose response, not linear relationship. Body weight, extreme underweight or overweight, it will impair the ovulatory function, reduce the ART success rate. Weight neutral lifestyle intervention before ART are recommended in several of the society guidelines like ASRM on ESHRI. Sleep is very important, adequate sleep. Whenever there is shift work or short sleep duration, they are linked to menstrual irregularity and altered reproductive hormone secretion. Circadian disruption is an emerging, still understudied, modifiable factor in reproductive endocrinology. When I'm talking about this, I'm remembering we did a camp in Tihar jail for women. You know what we found because of stress? Most of the women were, many, as high as 50% of them, young women were amenorrheic and they don't respond to hormones also because of stress. So stress has play a very important role. What about endocrine disrupting chemicals? It is a modifiable risk like BP and bisphenol analogs, disrupts the SPO axis signaling, reduces the GnRH secretion. So there is a defective ovulation. Phthalates impairs folliculogenesis, induces oxidative stress in granular cells. PFAS and persistent pollutants. I know there is so much literature about PCO where they say these things play a very important role in phthalate. There's a lot of work done by Delhi University also on phthalates, on persistent pollutants. Now comes our pesticide residues. That is the most dangerous. Linked to sperm DNA fragmentation in male partner exposure studies. And the problem with the pesticide residues are, this stays in the earth and it can go on for generations also. Some of the older pesticides, it could go on because you can't remove it from the earth. That is a problem. Now, what about the evidence review about PCO and combined therapy? Acupuncture plus moxibustion. Moxibustion is, I don't know if you people have read, there is something called a mox stick. It is some sort of a herbal thing. Chinese people burn it. As they have cups, they might burn it over the body or near the body along with acupuncture. 2023 work meta-analysis, there were 1,410 PCO patients. Combined therapy outperformed either clomiphene or acupuncture moxibustion alone. That is a combined therapy. Consistent with a broader pattern, adjunctive integrate therapy show most promise when it is layered onto and not substituting standard ovulation induction. Our medicines have to be there. These will only be a supported therapy. Now, in a body, mind, spirit group therapy derived from TCM concepts of stagnation syndrome combined with the structured group psychotherapy, what did they find? RCT evidence showed improvement in psychological well-being among Chinese IVF patients. They are doing a lot of research on the alternate therapy, Chinese acupuncture, Chinese medicine, and they use a lot of Chinese herbal medicine. Illustrates how culturally adapted frameworks can improve engagement and adherence, a practical but not just biochemical benefit of holistic integration. Now, let me just concise it. Let me critically apprise it as to what is happening. Let's say modality is psychosocial mind-body support. Where evidence is strong, it reduces distress, improves the quality of life. What is weak is direct effect on pregnancy and live birth rate. This is inconsistent. We will need large amount of RCTs. Mediterranean pattern diet, favorable cohort association, biologically plausible, but too few RCT, effect size on ART outcome unclear. Coming to acupuncture as an adjunct to IVF, some meta-analysis show benefit with adequate dose and timing, heterogeneity, sham control design contested, timing near ET, it may even harm it. Yoga and meditation and Ayurveda. Yoga improves anxiety, depression, PCO. These are all small RCTs. Whereas mostly they are single-center trials, live birth data is limited. Meditation and mindfulness, meta-analytic reduction in anxiety. Brief self-administered format, it has again show no effect on the pregnancy rate. Whether all these will increase the pregnancy rate, there is no RCTs. Ayurveda PCO protocol, promising conception rate in small clinical studies. Mostly uncontrolled case series, no live birth RCTs. Now, Chinese medicine, exercise and environment, Chinese herbal medicine, meta-analysis of 20 RCT suggests higher pregnancy and live birth odds with IVF. All are China trial-based, inconsistent formulation, low to moderate grade quality. What about exercise weight and optimization? Strong data on ovulatory function at BMI extremes. Optimal dose of exercise, it is not established. ETC exposure. This is the environmental disruptive chemicals. Strong mechanistic and epidemiological plausibility. Individual level clinical trials of avoidance are lacking. So, What is an integrative pathway alongside ART? First, screen the patients, assess distress, diet, weight, sleep, occupational, and EDC exposure at intake. Second, offer, don't impose, because we ourselves are not sure whether it is going to result in a live birth. So you can offer them this thing, but don't impose on them. Present evidence graded options, respect patient preference and autonomy. 3, layer, don't replace. So integrative therapies run alongside, never delay indicated. You don't have to delay an ART because that thing is not there. 4, monitor and individualize. Track the psychological and metabolic markers, adjust as cycle progresses, and finally, re-audit the outcome. That is the only way we will be able to reach a conclusion whether our treatment has worked. Feel real-world outcome back into practice level quality review. And it is these publications which will ultimately give us a better analysis. So integrative care is additive risk management and satisfaction strategy. The biomedical treatment plan remains the backbone of the care. So for the reproductive medicine clinic, what is it? Routinely screen for infertility-specific distress using validated rules and offer referral to structured mind-body CBT programs. Counsel on a Mediterranean pattern diet, BMI optimization before the stimulation cycle. This is, all the guidelines tell us this. Discuss acupuncture, yoga, or mindfulness as patient options with realistic expectations. Favor longer courses over a single pre-transfer session. Advise moderate and not excessive exercise. Address sleep, circadian disruption, particularly in shift working patients. Counsel on practical reduction of everyday EDC exposure. Especially these young girls, they use a lot of cosmetics. And when they come to you, if you ask, they have got some night care. In this, they use that retinol and all. That is not good for this thing. So plastics, food packaging, certain of the cosmetics, they are all, so these should be, we should counsel about them. And maintain a multidisciplinary referral network. You should have nutrition to send to a proper nutritionist, psychologist, Ayurveda TCM trained practitioner with shared documentation and safety oversight. So with that, I give you the take-home message. Evidence is graded, not evidence-free. Holistic modalities range from well-supported psychological support, dietary pattern to genuinely contested acupuncture timing, herbal protocol. Treat them individually, not as one bundle. These treatments are additive, not substitutive for ART. Strongest data support integrative care as an adjunct that improves the well-being, not a replacement for indicated ART. Research agenda is open. Larger, better controlled RCTs are needed, especially isolating active ingredients of mind-body program and clarifying dose timing effects for acupuncture. Leadership from reproductive specialists as specialist patients as most, we are best placed to curate which practices are offered and to keep the patient safety central. With that, I end my talk. Thank you very much.
Thanks a lot, ma'am, for the wonderful and exhaustive words of wisdom on holistic medicine. I would request our chairpersons, Dr. Shweta and Dr. Sonia Malik, ma'am, if you are there, would you like to comment on this? Can you please unmute Dr. Shweta? Please unmute. Please unmute Dr. Shweta.
Shweta?
Thanks, madam, on your excellent lecture on holistic medicine. It was highly informative, thought-provoking, and beautifully delivered. Ma'am, your depth of knowledge and practical insights made the session truly inspiring. Thank you, ma'am, once again.
Thank
Yeah,
you.
ma'am, I've been unmuted. Thanks so much. You know, ma'am, when it comes to holistic medicine, how many times it happens? Because sometimes when things are not working, and I tell my patients that, you know, you can resort to things which I feel that they don't harm you. So, which
Yeah.
could be like an art of living, breathing, yoga, pranayam, even acupressures. Somehow or the other, I do not agree to Chinese herbs because I don't know the side effects. So, what are
Exactly.
your views or what are your practical, practices?
My practical is one is I advise them that moderate exercise because
Yes.
most of them youngsters know they are these software engineers, they are stuck to the chair, there's no time to exercise. So I tell them at least moderate some sort of a walk or something. I tell them to take regular diet and to include some fruits and vegetables regularly into it to add antioxidants to it. And then if they are very stressful, I tell them do some sort of a calming mind program, either mind and body. These days, so many apps are available. I myself use an app. They can do that and meditate so that their mind is calm because that will your the pituitary and hypothalamic axis, it remains stress free. So my practical this thing is that, and as they rightly said, those who are doing shift duties or some of them, imagine I practice in North Delhi. Patient is traveling from Rohini to Gurgaon every day. So she leaves the house at 7 a.m., comes back at 10 p.m. When will she exercise? 3 hours.
Like yesterday, ma'am, a patient comes to me and she says, I want to plan pregnancy. I will go through an IVF cycle, but I have a night shift all my life. So
See?
this is so unphysiological, so
Yeah.
unphysiological. I said, no, you will have to talk to your company. And what are the rules in your company for women who get pregnant? What are
Yeah.
we need to find out, and I'll give you in writing. So there are so many things in lifestyle which
Yeah.
I think we also don't delve into, and which is making a tremendous change in the outcomes, whether it's
Yeah.
natural conception or
Definitely. See, they think coming for an ART is a shortcut to have a child.
yeah.
They think, "Acha, aa jao, bachcha kar lo, jao." That is not, it doesn't work like that. Dr. Anjali said, we can layer or we can, use it as a supportive treatment, but they themselves should be ready for that. Na?
This evening shift and night shift, it is so common, especially in people working in American companies, and they can't change it because the
No,
time
they can't.
Because that changes the circadian rhythm and all the hormonal imbalance, I think,
Yeah.
could be attributed.
Bilkul.
Ma'am, wonderful talk, wonderful. And the crisp take home message was really nice.
Thank you.
Thank you, Dr. Achal, for inviting me, and Dr. Sajjad.
Thank you so much, Dr. Shweta. The kind of discussion you bring in, I think no one else is
No,
able
I
to.
can give you a classic example. My niece, first IVF, no embryo conversion. Second IVF, no embryo conversion. Then I said, go into a major lifestyle change. 6 to 8 months she took. She lost about 8 kg. She made her diet better, high protein diet. After that, she made 4 blastocysts, and I just, she had a baby about 15 days back, and spontaneously in the past she was just having some biochemicals. So it took a very long road, but I contributed to a lifestyle change in her, positive outcome. So after that, I give more importance to this. So holistic medicine cannot be treated so simply. I think it's very intricate,
Yeah.
and it's complex too.
Yeah.
Just as the patients do not have time and patience to follow this, it takes long time, at
Yeah.
least 6 to 8 months. So if
Once
they
they're committed, no, Anchal, they will do it. Problem is to make them understand, kyun nahi ho raha, kyun nahi ho raha. This is the thing, no? We have to really convince them that this is what we should try and come back to us.
Ma'am, one very funny incident I can tell you. One of my patient had 5 failed embryo transfers. Uska endometrium would never be made with any drugs. She would tell me leave it, Dr. Shweta. I'm going to just exercise well for a month. She would do the pelvic exercise, and in natural cycle, she would have great endometrium. And this is what she did when she had the pregnancy. She said, no medicine works for me, only exercise works for me. And in a natural cycle, you will just see that I will have great endometrium.
You never know what. There was a case of adenomyosis. Her uterus was, the endometrium was like this, C shape like that. So whenever I do the transfer, it was so difficult to go in and do 3 transfers. It wouldn't work. I was just wondering what to do. Then for no rhyme or reason, she had ascites. Then you are thinking maybe Cox or by everything excluded. I called up, one surgeon had sent her to me. I said, look, she has got ascites. He said, doctor, leave her alone, let us see. I left her alone. Then what, as you rightly said, like your niece, she went and then she did yoga, exercise and all, came back after 1 year. She lost about 8 to 10 kilos. I don't know, Shweta, her uterus got corrected. Uterus was all right, now she's pregnant. I did a transfer. So you never know actually what.
We have to start giving.
Yeah, thank you so much.
Thank you, ma'am.
Thank you, ma'am.
You have given good example of the effect of holistic medicine on your knees. So as an integrated lifestyle, we can change the other things also. So thank you very much. Now we have to
Dr.
start.
Sajjad, you are on 2 devices, I think. Are you on 2 devices? No. Okay. There's a lot of time.
There's a lot of.
Hello. It is there. Now it's okay.
There's still a lot of echo.
Again, echo.
Maybe Dr. Shweta Mittal madam, it's the reason that when the patient is tired and they leave all the treatment and then they conceive after a few days. Maybe what madam says, that is right, that all the stress is gone and then they...
That's
Yeah.
Thank you for the wonderful talk and
Thank you so
discussion.
much. Thank you so much, ma'am, for the wonderful talk.
Echo is there again.
Echo is still there.
Yeah, can you keep it?
Now it's okay.
Now it's okay. It's okay. Yes. So let's move on to our next session, which is the panel discussion. And for that, I want to invite our moderator, Dr. Sajjad, Dr. Syed Sajjad. He is also the convener of holistic medicine, and he is the director of. He's the managing director of MedAge IVF Srinagar, and also the founder secretary and chapter secretary of IFS Kashmir chapter. Dr. Sajjad, welcome, and let us start the panel. And could you please also invite Dr. Sudha Prasad?
Yeah, I invite Dr. Sudha Prasad, ma'am, who is our past president IFS and director Maitritva IVF Center, Delhi. She is also the member secretary, Independent Ethics Committee IFS, and she has more than 40 years of teaching experience. So I invite ma'am Sudha Prasad, ma'am, also. Is she there?
Ma'am, are you there?
So till that time, she will be here. Let us go to our respected panelists. Yeah, our respected panelists are Dr. Shweta Gupta, ma'am, who is the respected IFS Secretary General and Director Fertility, Max Hospitals, Delhi and NCR. Dr. Rita Bakshi, ma'am, Chairperson RISA IVF and EPIA Team Leader IFS Delhi Forum. Dr. Rashmi Sharma, ma'am, Director Origin Fertility and IVF Delhi. Dr. Shalini Chawla Khanna, ma'am, Associate Director Max Hospitals Delhi and NCR. Dr. Sunobar Gulshan, Secretary IFS Kashmir Chapter and Clinical Director MedAge IVF Center Srinagar. Dr. Farzana Bashir, Joint Secretary IFS Kashmir Chapter and Professor Gynecologist Government Laldet Hospital Srinagar. Dr. Rehana Manzoor, Treasurer IFS Kashmir Chapter and Senior Consultant Gynecologist District Hospital Pulwama Kashmir. Dr. Neeti Vijay, Director the Clinics Fertility Head Phoenix Hospitals, Senior Consultant IVIA Fertility. Dr. Anjali Patil, Past Secretary IFS Western Maharashtra, member PCPNDT District Committee, postgraduate lecturer in Krishna Medical College, Karan. Dr. Anchal Agarwal, Director of Fertility and IVF at Kalavadin Hospitals, New Delhi. So welcome you all. Is there in now Sudha Prasad ma'am? Dr. Anchal, can you call Dr. Sudha Prasad ma'am?
Yes, I'll do that.
You just call her. I hope all the panelists are there.
Dr. Sajad, she is joining. Okay,
Yeah.
you carry on. वो join कर रही है. Computer on कर रही है. In the meanwhile, start कर दो. आप अपनी पैनल की इंट्रोडक्शन स्टार्ट कर दो तब तक.
तो already panel का तो बता दिया ना हमने already. That is already done. Panels we have, there are 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. There are 10 panelists. I hope that all are present in the session. So ma'am will...
Yeah, present, Dr. Sajad.
Yeah, ma'am. Good evening, ma'am.
Very good evening.
Good evening, ma'am. Dr. Rita, you were the first ones to join in.
Yeah, I know. Actually, I thought it is starting at 8. Suddenly, I realized it is 7. I said, "Oh my God, let me just join in."
So thank you so much for that.
Welcome. Dr. Sajad, I think we can start the, what do you say? Because we are 10 of us and 10 of us speaking on what kind of therapy we all are.
Yeah, I think Dr. Sudha ma'am will join.
Yeah. Let us start.
Yeah.
Cool.
So Achal, I think you sent us a kind of a questionnaire, telling us basically what I understand is what is that are we believing in alternative therapy or complementary therapy? Do we think it is complementary?
Yeah.
And then which therapy do we believe in? Is that right?
Most of the questions are around
Around that.
The main objective of this panel is to emphasize the importance of other therapies, because as allopaths and as we have studied medicine as MBBS and postgraduate doctors, we believe we have for years we have only believed in our form of therapy only. So when patients ask us homeopath and Ayurveda, we are clueless as to what to answer. Is it really beneficial? How much should they take? Should they go into acupuncture or not? So the main aim of this discussion is to find out with scientific evidence and with the literature available to us which kind of therapies is actually useful and how much should we emphasize, and what we should tell our patients. So that's the main aim of having this SIG and this discussion.
Absolutely. I think Shweta can start then.
So Mukul, you start the first question. Mukul? Mr. Mukul? So we will start with this question that is... Where's the question? Mukul? Yeah. Is holistic medicine complementary to IVF, or can it replace evidence-based fertility treatment? So we'll start with the Rita Bakshi ma'am.
Sure. So I don't think there is, I think there will be no two answers to this question. We all understand that it can only be complementary, it can never replace. There are examples, there are anecdotes, and we all spoke about whether weight loss can help getting a person pregnant, so many other things. But it will always remain complementary. Absolutely, there is nothing that can replace. Yes, but is it required or not? To that, I would say yes, it is required.
Okay. So can Dr. Shweta Gupta ma'am add something to this?
I think Dr. Sudha Prasad has joined. I saw her in the waiting room. Ma'am, are you there?
So till that time, the ma'am will be coming. Let us request Dr. Shweta Gupta ma'am, that she will add something to this answer. No, she's not there. Let us ask. Let us request Dr. Ashmi Sharma ma'am. She will add something in this answer. Mukul, please unmute the other part. These panelists.
I think Rashmi is not there. I can't see her.
Rashmi is not there. Shweta ma'am is there. Is Dr. Shalini ma'am is there? Dr. Shalini Chawla Khanna?
Shalini is there. Yes, Shalini.
Yeah,
Dr.
ma'am.
Rashmi is raising her hand. I think we need to unmute Dr. Rashmi.
Okay.
Yeah.
Mukul, please Dr. इसको unmute करो Dr. Shweta ma'am को.
Mukul, please unmute all the faculty members whoever are there.
post
You
बना
can
रखा है
see
मैंने.
the flyer.
इन 10 लोगों को हाँ
Yeah.
इन 10 लोगों को unmute कर लो.
पोस्ट बना रखा है.
हाँ, जो post है.
He's saying everybody.
Unmute Dr. Rashmi. Yeah. Dr. Rashmi, we've conveyed the message. Hopefully you will be unmuted soon.
Shalini, you give your
मैम के
opinion
माइक
till
में
that
शायद
time.
कोई
Come on. Shalini ma'am.
ऑन नहीं हो रहा.
Yeah, I'll give. I'm so sorry, Rita ma'am. There was a very important call. I couldn't listen what you said, but I think the question itself is holistic medicine complementary? Certainly, it is complementary because when a patient is going through an IVF, there are a lot of things to be considered. Holistic means the overall well-being of the couple when they are going for it. So they need to have a good diet, exercise, the lifestyle modification. They need to de-stress themselves. They need good counseling. They need yoga, and all these are the components of the holistic medicines. So, because every time, because there is, and the most important thing is they need to, they need to not to be so much on the Google and on the social media, because that leads to so much of stress when they read so much about all these things. So I think it is very, very important that we do a good counseling about all these things, about the diet, sleep, as Gauri ma'am said, about the EDCs also. So it is very, very important to give it as a holistic approach to a patient and not only the allopathic medicine that we suggest, because that is just one part of it. Agree, the holistic medicine cannot replace the treatment. They cannot undo the fibroids. They cannot undo the azoospermia and all. And the message has to be very clear that all this cannot be done. I have had experiences with the patients where they have said, where the Ayurveda doctors or the homeopathic doctors, they have said to 44-year-old patients, a woman, that we will revert your ovarian reserve, you will have good number of eggs. So it is very important where to draw a limit and what all these holistic medicines can be.
Yeah, thank you, ma'am. I think we will proceed to the second question. So
Hello,
so
my question with the Shalini, in holistic medicine,
Yes,
you
yes.
have told so many things. So will you like that the patient should go through each and every part of the holistic, or something which is important for only one part complementary can be given to IVF patient?
Yeah, ma'am, I think some parts are very important, like counseling. So if the counseling involves about the lifestyle, about the sleep, or the entire as a holistic approach, and I think that will serve a good purpose and that will help. The counseling itself will help in removing the negativity and giving the positive vibes and giving the realistic picture to the patients about the success rate. Then the patients are better able to cope with it, ma'am. I mean, it's not only one aspect. We need to, I mean, have all these things, which I think even as a fertility specialist or as a counselor can do a good job about this thing.
Yeah, so it is okay. So holistic medicine should complement, not replace. So
Yeah.
evidence-based, it should not replace evidence-based infertility treatment. So again, lifestyle optimization may improve natural fertility and ART outcomes. Patient requiring IVF should not be denied timely ART because of prolonged alternative treatments. So I will request ma'am, Professor Sudha Prasad ma'am, that she will proceed onwards. Yes, ma'am.
I think
Question
we have
number-
lost her again. Probably her connectivity is.
No, ma'am, it is already on the screen. Ma'am, you don't need your screen. If you want your screen, then you can have. Otherwise, already it is on the screen. Sudha ma'am.
I think
Angel,
she's
Angel, please, Angel, please convey ma'am that it is already on the screen. She's, it will go on. It will go on one by one. Can you call her?
to log in from her laptop.
She is logging up from her laptop, but we don't need because it is already, I have already sent to the Mukul. It is coming from there.
Madam is here already.
She came in between, but I think
she's visible on the screen.
She's on the screen.
Oh, she's
I can see her.
She's calling me.
Muted.
She's calling me.
She's muted. I think host will have to unmute again. I think she's muted.
Mukul, can you please unmute Dr. Sudha Prasad?
Co-host बना रखा है उनको खुद
yeah, that's the
unmute ma'am.
हो गया मैम, हो गया, हो गया.
अब हो गया. Hi Sudha ma'am.
Ma'am, the question is on the screen.
दोबारा.
Out from here only, ma'am. Ma'am, can you hear me? उनकी आवाज नहीं आ रही, although
उनकी आवाज भी नहीं आ रही, उनका लैपटॉप में कुछ म्यूटेड है.
One second.
I think Dr. Sajjad, we can go ahead because Rashmi, you can maybe answer this question now.
Yeah.
Mukul, just unmute the voice of Sudha ma'am.
सर उनका माइक ही शो नहीं कर रहा.
नहीं, प्लीज उसका अनम्यूट कर माइक, उसकी माइक अनम्यूट नहीं हो रही है.
So this question is, which lifestyle modification has the greatest impact on fertility outcomes? So I would say obesity reduction will be the most important thing. That will, because obesity definitely is like shown that it reduces both female and male fertility. So if I have to choose one modification, that will be obesity reduction. If I have to choose one.
I would choose stress reduction maybe as the biggest thing required, because I have seen and I've seen personally patients who call that they are going to manifest. Now manifestation has become something very, I remember doing a very, very bad embryo and being very unsure myself and telling my patient, I don't think this will work, but please be ready for the next cycle. And she said, Madam, don't worry, this will work. This was exactly what she said. And behold, she was pregnant. So I think somewhere so that means she was so relaxed in her mind. She was so sure in her mind. And I'm sure those positive hormones work a lot in their favor. Let me tell you, I think now with ChatGPT also becoming like a therapist, I myself consult a ChatGPT therapist very frequently. I remember having a problem few days back. I couldn't sleep. I was very guilty, with my children. And then I just put it in Chat GPT, and the answer he gave me, was that put me to so much rest. He said, "Ma'am, you have done the best. You can't do better. You just do this." And I said, okay, that made me sleep well. That made me stress free. And therefore, I think the mind, the stress probably is one of the modifications, whichever way. It could be meditation, it could be yoga, it could be whatever that you require. But somewhere that probably is one of the most important modifications, according to me.
So true, madam. In fact, I also advise my patients putting in earphones with meditation audios and manifestation audios, and that really helps to calm them down. And there are so much sleep hypnosis and available. I mean, we ourselves are also, we are living in such time that we don't need to the satsangs to attend those meditation. We are living in wonderful times, and that is a very powerful tool for the patients, no doubt.
And I think all the consultants here, all the fertility experts will agree with me. Like as Rita ma'am said, the moment you tell your patients that this cycle will not give you any success, they will conceive the same cycle because all the stress wanes off and it is the best cycle for them to conceive.
Can I request now, Dr. Sudha ma'am, her mic is on now, as per Mr. Mukul. Can she come? Sudha ma'am? Not coming. May I request Dr. Sunobar Gulshan or Dr. Farzana Bashir or Dr. Rehana Manzoor, who are on the line, they can add something in this question, in this answer.
Hello, good evening.
Yes,
Hello. Good evening, me, Dr. Snobar Gulshan from Kashmir chapter. IFS Kashmir chapter. Ma'am, as you rightly said, the reduction of weight is very important in infertility, as we see over the time, and especially we can see the regular physical activity, which nowadays is very less. People are sedentary lifestyle, so they don't work more. They just be indoors and all that. So
Can you open your camera?
Yes. 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 Yes, ma'am. So
pretty faces should not be hiding too much. Come on.
Just in a rush, I kept it off. So more particularly, I see that regular physical activity adds a way to infertility and gives a beautiful results. Most of the patients, they are indoors, sick, distracted, and all mentally sick they are. But once we just advise them go for regular physical activity, especially just for walking, 20 minutes will work it out. So I suppose the regular physical activity should be included in our infertility treatment, and usually the weight gets reduced by physical activity, and mind gets fresh, and automatically they will have a good sleep. So as per you, the best sleeping mode, there will be the patient will be relaxed, so the fertility will play, and the results will be good.
Yeah, I agree with Dr. Snover. According to me, I will also put exercise and diet as my first, medicine, holistic medicine, which complements any kind of treatment, not just IVF. I would say
Ma'am is
it's
there.
the most efficient stress buster.
Welcome, ma'am.
It should be the first, when we write our prescription, we should always advise adequate exercise and healthy diet. I guess it's most effective.
We see just Sudha ma'am. May Sudha ma'am will come.
I just want to tell you. Oh, sorry.
Yeah, now you are. We are listening to you, ma'am. We are seeing you.
Can you hear me?
नहीं, वहां पर दो लगे हैं, दो, एक फोन और एक लैपटॉप, एक बंद करना पड़ेगा तब इको नहीं आएगा.
Voice is echoing.
Can you hear me?
You have to on only one, either phone, either laptop. Because
Yeah. I'm sorry. Can you hear me now?
Yeah, we are hearing you, ma'am.
Yeah. So I just want to tell you one thing, that if we say that you will have the good nutrition, so immediately the patient will ask what kind of nutrition you want to say. What kind? Shall we eat akhrot or a leafy vegetable or something else? So we have to explain, and you can't explain to everybody in the same manner. Yes, people say Mediterranean diet is very good for these IVF patients who all are having the reproductive medicine problem. So one has to be mentioned very clearly. Sometimes they cannot do exercise, they cannot do. But if you say ki, yes, you sit at home only and do little yoga, I think that will be very beneficial, because I have done more than 700 cases of yoga, and it has been found that it was very, very beneficial, because it used to increase the blood supply to the endometrium. It has increased more follicles. So it was, I think, the mind is important, the brain is important, which has to be taken care.
Yes, ma'am. Thank you. Or as per the we are seeing the males, so they should cease their smoking. Smoking should be less. Reduction of alcohol intake should be less, and of course, their sleep should be better.
Yes, that is important.
So let us move to the third question.
And they should not be keeping the laptop too much on their laps also.
Yeah, of course.
Yes.
And the gym supplements where they
So-
give a lot of steroids, which
Yes.
does the reverse.
So our third question is, how important is nutrition in improving reproductive outcomes? Can I ask Dr. Farzana Bashir from Kashmir? Will she come on the here? Is Farzana Bashir here? Or Dr. Rehana? Dr. Rehana Mansoor? Nobody?
Yeah. Good
Yeah.
evening, everyone.
Yeah, okay.
I have been here for a while, but I was muted.
Okay, sorry.
That was the problem, actually. Okay.
Good evening, everybody.
Good evening.
So nice to have such a good talk. I was listening to all of you experts from everywhere in the country. Very good afternoon to all of you.
Good
So
afternoon.
this has been a really long debated things, that nutrition. Whenever in Kashmir, India, everybody is well versed with it. That everybody, a patient comes to a doctor after having his or her prescription, she or he always asks, "What should I include in my diet?" And
Yes.
rightly so. They were very right. So diet has been an important part of holistic medicine, Ayurveda or Unani medicine or allopathic medicine. A supplement with a diet, a dietary advice, has always been at the end of the prescription. And I think it is very important in case of fertility also. So first thing, I think uh, in our society at this point of time, we have so many like junk foods, sugary drinks, loads and loads of coffee and ready-made sugars. So first counseling has to be done about the natural uh, sugars, natural green leafy vegetables, diet, what they should include. And there, one thing I have noted in my practice, that after this medicine, explaining them about the medicine, they are very keenly listening to the dietary advice. This is the time when you inculcate this. Tell them that if you eat a potato, what does it do to their body? In comparison, when you eat a date or an apple having the sugar content, what does that thing do to your body? It is a complex carbohydrate. How does it slow down everything? Its digestion is right. It goes inside in the right quantity. Start having these healthy foods into your diet, like a balanced diet, whole grains, legumes, nuts, seeds. Instead of going for the chips and cola, go for nuts and seeds. Pumpkin seeds are there. There are important nuts like cashews, everything. For green leafy vegetable, they can take, in case, just shun that burger and pizza and go for a healthy juice, a handmade juice, and a pack of this nuts, dry fruits. So start having these very small edits in your diet, and you will see that whole scenario will change. I have seen a patient, she was like above 100 kgs of weight, not ovulating at all.
whatever you give. Then she one day when I counseled her about diet, I said that you have been treating yourself, you have been getting treated for the last 4 years now. Now take a break and just reduce your weight. And that was the turning point. She
So
reduced.
I think you, dear, I think your patient was very good patient that she has
Yeah.
understood.
That is
and
why I'm giving her example. She
But not
took
all
a break
patients.
for after 6 to 7 months. She came to me. She had really reduced, and as you all of know, you are all big experts in this. You can very well predict this. She conceived, and she had a, believe me, after all stimulated cycles, she had a spontaneous pregnancy.
This can happen.
Just on a good diet, exercise, weight loss, and one drug she was constantly on, that was metformin. That is doing the same thing for us inside. But I think this diet counseling is very, very important for females as well as males.
Thank
They
you,
should
Farzan.
also switch to the healthy diet.
Thank you.
We have everything all around us. Just we need to see that.
It's a very good advice. But when you say to any infertile patient who are more than 7, 8, 9 years of married life, trying very well for the child,
Yeah.
and if you say that you go and do exercise, have this nutrition, come after 6 months, they will go somewhere else. They won't follow.
I
what kind
understand
of
that. But
uh,
actually, the
it is
first part I want to say, जो अभी यहाँ पे discussion हो रहा था अभी, the first thing I wanted to add is the first and foremost thing out of all these options is a good counseling.
Yeah, that is important.
First, we have to make her understand how does this work. You have to take some extra time to make her understand, make the couple understand, men and women both, couple understand that your nutrition, your lifestyle, it works. So we have to, जिस तरह हम anatomy show करते हैं कोई surgery से पहले, that where is the problem, this is the thing that has been involved after fallopian
that
tube
is
खराब.
that
बिल्कुल
is
वैसे ही.
good. Somebody else wants to add something?
I can request from the other side of our map, Western Maharashtra, Anjali Patil ma'am. Is she there? Yeah.
What I would like that whatever he has said is all correct. That diet and going. It's just that we have to use these small opportunities.
Actually, you are echoing.
Both.
It is echoing. Is there Dr. Anjali Patil?
Yes, sir. Actually, whatever the panelist has said, I really appreciate that. But maybe, actually, I want the answer from other panelists and other esteemed faculty also. That is it better to counsel them to a dietitian, or should we tell them, because we are not like prepared, or we don't do courses everybody. So actually what to tell that patient, how much portion she should eat, how much proteins, whether we can tell them or we should consider dietitian. That is the question which I really wanted to ask.
Good evening.
Good evening. Yeah.
I'm
Dr.
Dr.
Rehan, can edit.
I'm Dr. Rehan. Yes. I would like to counsel myself rather sending her to dietitian, because after a good counseling, and now we manage so many infertility patients, and we have also hard on diet and other things, and more of that, patient is already receptive to us, because patient now wants everything at us, because patient is already tired. He does not want to go anywhere. As much as we can counsel her with us, we should that. We should, unless and until the patient is having some gross, like she is diabetic, she is having some metabolic syndrome, and but a little bit of just like weight reduction, stress management, and more of recently I have seen that most of the infertility patients after some years go into relationship constraints with their husbands. That is the main reason. One of my patients from infertility for 3 years, When I asked her alone without her husband, she wept in front of me and she was telling that they are having every night fight. I counseled her husband and they conceived naturally after 4 or 5 months.
That's very good. That's very good.
We should not neglect the role of dietitians or psychiatrists or counselors, but
Exactly.
patients are already very constrained when they come to us. We should do maximum of our selves, because patients then get faith in us, and when we work on their relationship status. One of my patients was with a relationship constraint with her in-laws. I counseled her husband alone. I shifted for 3 months to her mother's home, and she conceived, and today morning, after 3 years of marriage, there was spontaneous conception.
Thank
That
you.
is
Thank you.
very good. Stress is relieved and she has a spontaneous conception.
Right.
So the stress is a very big factor.
So,
It has been seen when the stress is there. If the counselor can do the scoring system and she can find out that how much is the stress, and with a good counselor, if the counseling is done, then also you can measure the scale that how much is the stress, and then it can be relieved with the proper counseling. The counselor and gynecologist also both
Exactly,
should
ma'am.
counsel. Yeah.
Exactly, ma'am. But what we can do ourselves, I think that our patients want everything from us, and we should have such patients, and mostly patients listen to us.
Yes,
So,
very rightly said.
so take home message for the nutrition is that nutrition influences ovulation, sperm quality, and metabolic health. Adequate protein, fruits, vegetables, omega-3 fatty acids, and micronutrients are beneficial. Correct nutritional deficiencies before ART whenever possible. So let us move for the fourth question. Mukul.
Yeah, next question.
Next. What is the magnitude? So next question is what is the magnitude of stress related to infertility? Activation of hypothalamic pituitary adrenal axis increases cortisol secretion. Persistent stress may influence. Yeah. Can we ask Dr. Shweta ma'am? Will answer it. Is Shweta ma'am there? Shweta Gupta, please unmute all the participants. Mukul? Dr. Ashmi Sharma ma'am?
Yes, yes.
Yes, please.
So I always tell my patients, whenever I see that it's a very stressed patient, I always tell my patient that, our hormones are regulated from the hypothalamus pituitary, and hypothalamus per se in the brain is very close to the amygdala center in the brain, which is responsible for the emotions. So any kind of major stress in life, like divorce, like death, like even sometimes board exams, exam anxiety, the pattern that we see is the patients go into amenorrhea. So that's the example I tell them, that stress is so important because from the brain it's being regulated. So if stress is there, definitely the chances of having conception definitely decrease. No doubt, stress reduction is extremely important. Everybody has seen such patients where when the stress got reduced, the patient conceives on its own so many times.
Very clearly said that if there will be a persistent stress, then GnRH pulsatility will be different, LH-FSH secretion will be more, and there won't be any ovulation. Endometrial receptivity also finishes, and this even in the male, the sperm quality. So stress is a very big factor which has to be relieved. Definitely, you said the very correctly, Rashmi.
Can Dr. Niti Vijay add something? Is Dr. Niti Vijay there?
Yes. Hello, sir. Good evening, everyone.
Good evening.
Niti, your voice is
Yes.
echoing. I think two devices are on.
Two devices.
Am I audible? It was
Yes.
because of the headphones.
Yeah.
Yes, sir. I definitely agree with Sudha Prasad, ma'am. Stress does affect the egg quality and the endometrial receptivity. along with that, it also causes a lot of emotional disturbances, sleep disturbances, which again affects your circadian rhythm. It causes anxiety, depression, sometimes even sexual dysfunctions, erectile dysfunctions, performance anxiety, and definitely reduce quality of life. So yes, in my view, definitely stress affects fertility.
Yeah, okay. Let's move to the question number 5, ma'am. So it can influence LH and FSH secretion, ovulation, endometrial receptivity, and semen quality. So let us move to the question number 5, ma'am. Does stress reduce fertility, or does it mainly affect the quality of life? It was already discussed, maybe again.
Yeah, we can go on another one.
Okay. Question number 6. Should every IVF clinic provide psychological counseling?
Yes, this is a very good question. Please answer.
I think
Yes,
without
ma'am.
fail. Yeah.
Yes.
Right. Okay,
Without
Rita
fail.
Bakshi, ma'am.
Yes,
Yes.
ma'am. It's very, very important. It's very,
Yes.
very important.
Yes.
At every stage of IVF, at every stage of infertility treatment, because as we already discussed, that stress is very much contributing factor, and it when the patient does not adhere to treatment once it is IVF failure or ovulation induction failure, so psychological counseling is very important.
Okay, ma'am.
Psychological counseling is also required because we know the results are never 100%,
Right.
and
Right.
we do want the patient to continue
Yeah.
coming and at least trying enough times. And for that, a psychological support is really required. So
Yeah.
here, the role of psychologist will also become major, besides, of course, all the time that we require him during the cycle.
And Dr. Rita, what is the ART law is saying about it?
Yes. The
We
ART
should
law.
not forget. Yeah.
No, I absolutely. You should not forget that the ART law mandates that we should have a psychologist in the clinic, and who should be also looking at so every patient should have a psychological consult, or in the IVF cycle. So I think it is a very good move, if we say by the law.
Ma'am,
Yeah.
I have a question here. Can I
Yes.
ask a question, ma'am? In
Mhm.
the ART Act, they have said that it should be a counselor, and actually, they have defined it should be preferably a postgraduate in either social science or psychology or any branch of life sciences with experience in the IVF counseling, है ना? तो मतलब otherwise, what are we doing in the ARD clinics? Is it always a psychologist who is posted as a counselor, or is it maybe some postgraduate in life sciences, social sciences, as a counselor? I think that law has left that loophole.
Yes,
Of course, there is a loophole, but actually the psychology student, if you will go to the university, they do not know that they can enter also in this clinical branch, and they can also sit in an IVF clinic as a psychologist. So we are the one who should try to make them like embryologists, life sciences, how the life sciences people came in embryology.
Yeah.
Now,
Right.
we are the one, we have trained them, and we said, this is your line, you can come here. So similarly, the psychology student, even BA psychology student also can come with the little fellowship or some training program, and IFS can give and are going to give now. Like we have already advertised about the psychology counseling sessions. So they can be after some days. Of course, we are short of that, but now we will definitely get like we are getting the embryologist. So it should be mandatory. Life science person cannot think of what is the depression, what is the anxiety, but the
I think
psychology person
I
will.
want to add some. Excuse me. I want to add
Yeah.
something to it. I
Yes,
think
yes.
the first session or the first few session, to say like that, with the gynecologist or the treating physician, I think the first counseling should be there. they have put in some trust in you if you start with your session with some sort of counseling for both partners, not only male,
doctor.
not only female,
I
male
will tell
also.
you. I will tell you that nobody is
I think that
stopping
has
a
an effect.
gynecologist. Nobody is stopping gynecologist to do the counseling. Question is coming that it is the
But in
mandate.
addition, we can have, right?
It is mandate.
And I think that counseling should be focused on both of them, because so many times we have seen that the male partner cannot even give the sample because of the anxiety.
No. That
So
should
many
be
times.
for both. That should be for
Yeah,
both.
both.
We
It
should
should
not
be for
ignore
both.
male partner. We should not.
We should never, even in natural cycles,
Yeah.
they have come up with the complaints that whenever we have been asked for timed intercourse, it fails. I think they need to have some de-stressing sessions. That is where these yoga sessions, जैसे आपने बताया है, or we have something else, or gymming can be also there. That has been a very good thing.
Definitely,
Activity induces endorphins release. जो endorphin release होता है, activities high up होती है. It is a major stress buster. So today, if
very
you
right.
don't have yoga centers in your vicinity, you can always have a very good gym, and that has a great results. And for both partners, I always emphasize on the counseling or any advice.
Yoga
You
can be
should
done.
always have both
Yoga
partners
can
in.
be done on online basis also.
Yeah.
Because
Yeah,
it
right.
can be
They
done
can,
very easily. There is
you
no
can always
problem.
see exercises on YouTube. We have so many. We have information overload this time. Patients are sometimes better educated than we are. So
Yes.
we should just show them that direction. They are
Okay.
showered with
Can we go on next question?
So it was the question about the IVF clinic. So as per the IVF clinic, we should have the counseling before the IVF, during
After
the
the
IVF,
IVF.
and
Yeah.
after IVF. And
Definitely before the IVF.
It should
before,
complement
before,
gynecologist.
Before
during,
and
and
after.
every time.
Continuous.
Before and after. During
Let
as
us
well.
during this. Let us move to question number 7. Let us move to question number 7. Question number 7 is there any relevance of yoga, meditation, and mindfulness in fertility management?
I think we already
all
answered
done.
all this.
All done with.
It is already done.
All
It is
done.
done.
Next question.
Next question is there any relevant, again, same.
No, this is the same.
Question number 9. Mikul, question number 9. Should acupuncture be routinely recommended during IVF?
No.
Anybody has experience of this?
We have no
I have.
experience.
have.
Dr.
Yes,
Shalini,
ma'am.
I
Yes,
have.
ma'am.
I have.
I have
So
too.
let
Shalini,
me
ma'am.
I will do that before Shalini. So I presented this paper in Aspire this time, in which we have our Chinese acupuncture, and we presented in China the acupuncture that we tried in our patients. We did the cycles in 29 to 40 years women. We did the first cycle. This was cumulative egg freezing cycles. And we did the first cycle without any acupuncture. And this next cycle we did with acupuncture, but we also added some antioxidant drips. So the idea or let me tell you, nothing brings any complementary therapy doesn't bring absolutely great results, but the number of eggs that were retrieved were more, as well as the quality. And this is the paper that we presented in Aspire this time. So according to me, acupuncture, again, we are again saying it's a complementary therapy, it's nothing to replace. But yes, after I did about 80 patients, I thought it does have its place, whether in balancing of hormones, whether in increasing the blood supply to the organs, but it did bring a little bit of a change, which is what we are really worked on.
I will tell you, there are the systemic reviews which has shown very, very clearly that acupuncture relieves the stress, it increases the pelvic blood flow, and naturally the patient satisfaction is more.
Okay.
Actually, there is a lot of variation in the patient's acceptance of acupuncture, we had also started a study of doing acupuncture before embryo transfer, on the day of embryo transfer, but there were so many patients who actually felt, they were not relieved. They actually felt more anxious because it is a little invasive modality compared to
Yes,
others since
yes.
we are using needles. So the acceptance is not same. It's not, homogeneous overall. So I guess rather than, we have to individualize because uh, everyone doesn't, feel very
Like it. Yes.
confident. Yeah,
Yeah.
they may not like it because it's a
Very rightly said.
So as
Yeah,
the question,
even I would say that
Yeah, Shalini.
this
Shalini,
being an
Shalini ma'am.
invasive, so like patients are also more acceptable to the psychological counseling, to the yoga, to the meditation,
No,
and
that is all right. We
yeah,
were on the acupuncture, whether
yes, ma'am.
anybody has experience or not. But it is
So
a
ma'am,
very limited
Ma'am,
experience, and we
yeah,
should
yeah.
Actually,
try.
ma'am, maybe it plays as a placebo.
Yeah,
ma'am,
maybe
but
placebo.
Placebo.
Huh.
Yeah,
Ma'am,
that
but
can give.
sometimes the acupuncture therapy has to be done really rightly because some of my patients they had stress relief, जैसे सुधा मैम ने बताया. Secondly, they have an increased number of follicular count also. And one of the patient who was chronically doing acupuncture for 1 year on her own self, when she came to us, she had endometriosis and she had a resolution of endometriotic cyst. ये एक ही
Oh,
patient है
great.
जिसको हाँ, yes ma'am. But that
Acha.
has to be done very rightly at the right point. The acupuncturist
Right.
should also be a
And
this
before that,
person.
Niti, you have to do a very good counseling that everything has been failed. Probably this method is going to be successful.
Yes.
Then only she will
Absolutely,
take
ma'am.
over. Yes.
Absolutely, ma'am.
Okay.
So,
Absolutely.
So we can
as
move
per
to
the
the
Again, here
next
comes
question,
the
please, as the
counseling.
time is
so,
short now.
as per the question, it is if we'll use it routinely during IVF, so the answer can be current evidence is mixed. Some patients report reduced anxiety and improved well-being. There is insufficient evidence to recommend routine acupuncture solely to improve live birth rates. It may be offered as an adjunct by trained professionals. And let us move to the question number 10.
Dr. Sajad, Dr. Sudha,
Yeah.
Yeah.
I would also, there is a role of chelation of heavy metals. And this I saw in one of my own patients. Her AMH was as low as 0.2, and she in absolutely right hand, where they are measuring your heavy metals, cadmium and mercury and all that. So there are tests which are there, and then they chelate with EDTA, and then they measure. And she also spontaneously conceived. So I was not a big believer of all that, and of course, but there are people, and this is from UK. So there are people who are measuring the so somewhere. I mean these are something which we don't really talk on. We talk of acupuncture, moxibustion, acupressure, but there are some treatments like these which also, because I asked and she said in UK this is very well established. There were clinics which are measuring the heavy metals and chelating them, making them free of those heavy metals, and then she did
Geographically, are they staying in that area where the heavy metals in water or the
No,
food, something
no,
like this?
no.
Oh, so
Not
this is
not
a
like that at all.
Mm,
Yeah,
mm.
that is why I thought, because this was, and in fact, I thought we should have a full webinar on this
Yeah,
topic itself because this is something absolutely different.
I think
Also,
this is something new. Yes.
yeah. Also, hyperbaric oxygen chamber, which is common, but ozone sufflation through the rectum and to the
Mhm.
vagina. Also, according to her, I mean, according to the doctor that I finally spoke on because this was my patient, and she said even these have a role. And I said, I think we should learn because these are complementary therapies. These are not something, which we can, I mean, if we have the proper knowledge, we can add on to some therapies like these. So I think this is just to say now, even Ayurveda, your next question,
Yeah,
ma'am,
yeah, please.
Yeah.
Ayurveda also, one of my patients, I mean, she went for this basti, they pushed in the ghee in her uterus, vagina, wherever. When
Push
she
the
came back to
oil.
me, when she came back to me, I could see the ghee ke blobs, But one surprising thing was, Dr. Sudha, she had zero pain during menses after that.
Oh,
So,
great.
yeah. So although the conception part remained the same, I mean, but from that day onwards, she said, I have absolutely no dysmenorrhea. And she was very severely dysmenoric. So I don't know how, whatever plays a role somewhere. That's it.
And this batti thing is very common. They put
Yeah.
some top, and I have seen many cases of improved endometrium after this treatment, which we were unable to tackle. They were
They
not
put some oil. They put some
Yeah.
oil in the where the vagina.
Not
yeah.
desi
So
ghee.
kept there for some time, for a couple of days, then they change it, and it has shown to improve blood flow and improved endometrium. I have seen few cases.
And overall well-being is good in these patients. Probably
So,
There
stress
is a
management. Yeah.
use of ashwagandha and shatavari in the Ayurveda medicine.
Hmm.
Probably helps in their overall immunity and maybe indirectly their overall well-being.
so we should
Can
use
I
only
can I comment?
evidence-based environment and regulated access
Rashmi,
only.
yeah.
Yes,
Yeah,
ma'am.
Rashmi ma'am.
My opinion is a little different, ma'am.
Yeah.
I have seen so many patients destroying their so many precious years.
Yeah, yeah.
Low
Yeah,
AMH
with this
with Ayurveda.
Ayurveda.
I mean, this is something crazy. Patient of 0.3 AMH going for an Ayurvedic treatment for 3 years, 4 years. One of my nurses, mother-in-law, had cervical cancer stage 1, went for an Ayurvedic treatment in spite of being a nurse, and lost her after some time. So, but it's a double-edged sword.
Yes.
A double-edged sword. We have seen infections also after Uttar Basti sometimes says because they are using oil-like things. As HSG has shown to improve the fertility following the lipoidal, infusion, sometimes that kind of factor can work because it's like a tubal flushing.
Yeah.
With that tubal flushing, plus these are oil components, as you know, there are very beautiful studies that HSG, if you do with the contrast agent versus if you do saline infusion, pregnancy rates improve in HSG, but not in the saline infusion. There are very beautiful document studies on that. So maybe that is how that might be playing. But then we have to understand that number one, how much time is being wasted. I mean, 1 month, 2 month, 3 month is fine. But sometimes patient wastes years and lots of money, and they lose crucial time. So one has to be very careful. It can be taken just as a complimentary. Matlab, this is what is my feeling.
Excuse me, ma'am. I want to add something.
You are very
Excuse me.
Rashmi.
Excuse me, ma'am.
Yes.
Yeah. Excuse me, ma'am.
Yeah.
I want to tell something. Being allopathy doctors, we should not promote the Ayurveda, because always you see whenever Ayurveda we prescribe, it's in a crude form. We don't even know the composition of the either whether it is a tablet form, capsule form, or liquid form.
No, it's not like a allopathic doctor, ma'am. No, but I just want to tell you, it comes under Ayush. So we are not speaking about the Ayurveda. If they say they can go for the Ayurveda, they can go simultaneous.
Yes.
They do not waste their years of fertility.
Yeah, that's my question. That's my question.
Yeah.
So better is to proceed with the formal treatment.
For the use of evidence-based or
Yeah, evidence-based medicine.
we should not delay in indicated ART.
Yeah. That's it. We should not rely on the medicine.
One or two patient conceiving is actually purely anecdotal evidence. We are
Yeah.
living in an evidence-based
The
age.
voice is
If Uttar
echoing
Basti works so
again.
much, we should be doing, studies of 1,000 patients, RCTs. Because just 1 to 2 anecdotal evidence, I don't know whether we should be really promoting that.
Very rightly said. Yes. What is next now?
Next is how can we integrate holistic medicine into routine fertility clinics?
Yeah, I want one line from everybody.
Yeah.
Nutritional counseling. Nutritional counseling.
I think it should be lifestyle
modality.
Yes, even I think
lifestyle modification with diet and exercise. We can never ever underscore this. That cannot be never ever neglected.
Yeah.
Stress management. stress management and telling the patient that uterus is not only your organ, you are a full body with multiple organs. You need to take care of every
So
organ.
only one line, please. Only one line. Only
The
one
voice
point.
is
Not,
echoing
not
again.
multiple lines. Yeah. Only,
Someone has joined from
yeah.
to again
Counseling.
voice.
Counseling. Very rightly said. Yes.
Yes, ma'am. Counseling and the lifestyle modification are the two important factors should be
Mhm.
inculcated in the infertility management.
So,
And we being the primary physicians, patients do listen to us, ma'am.
so stress management comes first. That one should have the decrease the stress level, and then we should proceed for this. Other than in holistic medicine, which component you feel that it is important other than the stress management and the lifestyle modification?
Patient education.
Patient should be counseled. Yes, counseling.
Educate. Yeah. Patient education should be done.
Counseling regarding the success
Counseling is
rate
there.
of IVF.
So you have,
Psychological counseling.
so one has to keep
Tell them
keep
about
one has to
financial.
keep patience and speak about each and every step of the IVF treatment. This is important.
Okay.
Right.
Okay.
Yes.
Anything left now, Sajat?
No, now 12th question number 12 is if you could introduce one holistic intervention into every fertility clinic tomorrow, what would it be?
Oh, बोल दिया ना lifestyle management.
Sorry.
Yoga, which will relieve the stress also and will be exercise also.
Yes.
So
It
now,
will go
ma'am,
both ways.
there is case discussion. This is the last case discussion. Let us discuss the clinical scenario. Patient profile is female, age is 34 years, primary infertility for 6 years, sedentary lifestyle, 2 previous failed IVF cycles, high perceived stress, poor sleep. Her BMI is 29 kg per 29, normal ovarian reserve, mild male factor infertility. How will you manage this couple? Shalini ma'am.
Yes, sir. Since this patient has high BMI also with previous two failures with borderline ovarian reserve, and I guess there was, sir, if you could display the, yeah, two
34
previous
years old. Yeah.
high perceived stress. So poor sleep. Sir, I think the counseling, maybe involving as a psychologist also will definitely help because first of all, as the entire discussion after this webinar, everybody agrees that stress does play a very, very important role. So by the counseling, we need to de-stress the couple, counsel her on the diet modification and counsel her on the high BMI, that how the obesity can impact the ovarian reserve, the oocyte quality, the ovulation, and in men too, the erectile and the ejaculatory dysfunctions. So it has to be a very thorough, detailed counseling, and maybe then the role of dietitian and a psychologist can also be involved here to guide her regarding the weight management, and obviously the probably the stress is also leading to the poor sleep. So I think a very detailed counseling, and every time the patient has to be, so many times they become so much negative, like, they are just into depression, anxiety. So a very good counseling will definitely play a role considering all the factors. And it is very important to keep their morale high, both the partners, and not to lose faith because she has a normal ovarian reserve and only mild male factor infertility. So at every step, we as a physicians, we as a counseling we do, very important to make them motivated, to give them that yes, they can conceive, there is nothing wrong. I think that will play a very big role.
So you think, Shalini, that this patient will have the good counseling, and as soon as she decreases her weight, she will conceive spontaneously. Is it? Even though it is a failed, we do not know failed IVF is due to what.
Yes,
It's
ma'am.
not a tubal.
Yeah.
It may not be tubal.
Yeah, she has sedentary lifestyle also. So if we counsel about about the exercise part, the yoga part, then that will also help her, ma'am.
I hope
Madam,
all the panelists, any panelists want to
Yes,
speak
ma'am.
anything?
For
Madam,
her,
what
I
I
believe
no,
that
One by one.
these all things will complement her fertility journey, but it should not be, as we already discussed it, that patient is having low AMH, borderline fertility, and male factor is also weak. We should not waste time. We should run in a parallel way.
No, it's
We should
normal
not
ovarian
forget.
reserve. It's normal ovarian reserve. Please read out the case.
Madam, what I think is we have to review why the cycles were failed last, and then we can shift over.
Yes.
Dr. Sudha Prasad, maybe she will say yes to this, because we have to find out how the USAIDs were, what had happened, how the embryos were, and then if she
We
has
have to use the
reactive
standard
activity.
IVF protocol.
So maybe, so we have to first find out, and then we can shift over to whatever we said, that lifestyle modification and to reduce weight.
Very
We'll
right.
have to find out, and then we'll have to give her a short 3 or 4 months break. Let her do the lifestyle modification, then come back, and we'll have to really think over what protocol she will need.
I hope everybody agrees on this.
Yes, ma'am.
Yes.
We have to investigate for RIF
Good.
and implement all the things for RIF.
Yeah.
In fact, including the karyotype for the couple. So these are two IVF failures if provided they were good blastocysts. So karyotype has now been introduced in RIF. That should be done. Hysteroscopy should be done. Of course, hysteroscopy, TB expert,
Of course, we should not forget the protocol. We should not forget IVF.
That is the management.
center.
And
So
ma'am,
we should go for a standard IVF protocol.
Very good. Very good.
And
ma'am,
of
along
course,
with
there
this,
is
yes, one has to work up for the failed IVF. Along with this, expert opinion of psychologist, psychiatrist, who can also treat her medically with some mood elevators for high perceived stress. Just to add on a last point, covering the whole things.
as
Very
there is
good.
normal ovarian reserve and there is mild male factor. So first of all, we should tell his husband that you stop smoking, you decrease your alcohol intake. That is must, because there is a normal ovarian reserve but mild male factors there. You see on the last of the question. So we should take into account the male factor, why there is male factor, and what type of, because last time when we have done the IVF twice, we should see, is there oligospermia, is there astenospermia, is there teratospermia. Accordingly, we will advise the male to what to do. So,
So
ma'am.
Endometrial factors should also be taken into consideration.
Very right.
Endometrial receptivity.
Yes.
So we can stop here now.
Yes.
I really congratulate all the panelists. They have done the wonderful, and finally we got the message that really holistic medicine also should be the complementary in this IVF protocol. But we should not forget the IVF protocol. We should not jump on Ayurveda or acupuncture. We
Exactly.
should do our own workup first, and then only we should add something which is very much important to these patients. So we can stop here, Dr. Sajjad.
Yeah. Thank you very much to all the
Thank you so
panelists,
much.
all the doctors.
Thank you, dear.
Thank you very much.
Thank you, Sudha
Thank you,
Madam and
ma'am.
Thank
Dr.
you, ma'am.
Siddharth,
Thank you so
for
much.
SIG,
Thank you, ma'am.
moderating.
this SIG is doing wonderful, I think, in future also.
Yes, ma'am.
Thank you.
Okay, dear.
So thank you all for joining in and for sharing your valuable inputs. It was a very, very interesting discussion and we all gained from it. Thank you so much.
Thank you, Dr. Gauri.
Thank you, ma'am.
Very excellent moderation.
Yeah,
Excellent moderation. Nice
moderation.
panel.
Very true. Very true.
Thank you.
Thank you,
Thank
everybody.
you, everyone.
Okay, bye-bye.
Thank you, everybody. Thank you, ma'am.
SIG.